Okay, let's talk about ACS for full scalp hair restoration or a 360 restoration. This is addressing all the hair loss needs on your scalp, not just the area we did transplantation. So why does this exist? This is because early in my career, a little overzealous, and you would tell people you can restore their entire hair, and you just can't. There's not enough hair in the vast majority of people to supply the entire top of the scalp, and at some point in time, you're going to run out of hairs. If you don't plan appropriately, you'll have sparse coverage across your entire scalp. That will not look good. You could have partial coverage in your scalp where you filled in the early parts of loss, but then future loss, you didn't have enough grafts for it, and now you get this odd-looking shape to your hair restoration. Well, the best thing to do in reality is to know what you can restore in the future. And now that we do timeless hairline and hair designs, we actually know where your final future endpoint is going to be. We can look at the grafts you have, and we can tell you what you can reasonably expect to cover. And depending on how old you are and how close you are to the final end stages of your hair loss, we know with increasing accuracy what we can use those hairs for. But in the meantime, I had to develop a technique to help restore the remaining hairs that couldn't be addressed by surgery, because otherwise my results were going to be less promising than the guy next door. So ACS is actually what developed because we were trying to make our surgical results better by limiting surgery to what it only should be used for your long-term future. ACS is autologous conditioned serum. It's a wound healing therapy in which we take wound healing cells out of your blood and we inject them in the scalp and create a wound healing environment for 6 months. Now, what's important about wound healing is that in wound healing, the number one thing you need to do is increase blood flow to that wound to cause more nourishment of the hair and skin cells that are in that area such that they can replicate. And when they want to replicate, you need to have growth factor that support that entire process. And ACS is something we can use along with a transplant to make the results across your entire scalp better. So the most common presentation that I'll see in my office is someone who has a front hairline that wants to be restored, but also a thinning crown. And I'll know that, hey, we can make this front hairline look great with a transplant. And I know that I can preserve those results long-term without any issues, but you have to give up the crown. We don't have to give it up anymore. We use ACS to make the crown better naturally, to increase its density and its fullness such that you get a 360 result that results in a better outcome than a transplant alone. Now, this is my personal story. I actually had a hair transplantation in my front hairline twice. And that was possibly a mistake. I did it once to kind of get a sense of what it's like for my customers, second time to hire a new teammate and make everybody operate on me. And I had a hair transplant front hairline. Well, after my transplant, I got on the top medications we have in our office and I did ACS. And now my natural hairs are in front of my transplant hairs. The hairs in this very front hairline are no longer my transplant. They're once been grown by ACS. ACS is a very powerful technique to make your natural hairs grow. And I will tell you if ACS is appropriate for your crown or your hairline to even avoid a transplant altogether or to augment a transplant. And in this case, we're talking about is doing a 360 hair restoration using ACS. It's to actually make sure that the result overall across your entire scalp looks good using non-surgical techniques to augment our surgical techniques.